of the coracoid process. Most often it's very simple to feel it. Here it's very, very simple. And if it's difficult, then don't search with one finger. Then you go with 2 fingers from laterally. You feel the first bump. This is caputumeri, and then you follow, and you will feel a second bump under the muscles, and this is a coracoid process.
찾기 힘들 때, 찾기 쉬우면은 바로 이렇게 코라코이드 시작하면 되는데, 힘들 때는 가쪽에서 한 손가락 말고 2 손가락으로 시작을 합니다. 그래서 첫 번째 덜컹거릴 때에는 이런 윗팔에 있는 근육들일 수가 있고요. 2번째 덜컹거림을 찾는 겁니다.
And the muscle runs from the second, third, and fourth rib in this direction.
그리고 2, 3, 5번 갈비에서 시작을 하고요.
So I can perform the palpation through the relaxed pectoralis major, and often you can feel these fibers like this. Here I feel them.
그리고 먼저 펙토럴리스 메이저를 이완시키기 위해서 저 위치에서 만질 수가 있고, 이때 이제 결도 느낄 수가 있다고 합니다.
If you reach to reproduce the pain familiar for the patient, you don't know is it the problem in the pectoralis major or minor.
지금 이렇게 환자한테 통증이 있을 때 환자한테 물었을 때는 이게 메이저인지 마이너인지 알 수가 없고요.
For the result of the therapy, it's not important to know is it the major or minor pectoralis.
그래서 요거를 구분하는 게 치료 결과에 조금 영향을 미쳐서 it's important to discriminate, right?
It's more important to treat it than to know. But if you want to know, it's no problem to get the differentiation. But please treat it. So, you feel pain? Okay. This would be the pain familiar. And then I can perform this situation. You feel the same pain as before?
No.
No. So I know the pain before was in the pectoralis minor. Huh? And if I reach to reproduce the same pain now, I know it's in the pectoralis major. Okay, so it's no problem to differentiate. This is the main approach. Now you can please keep your arm here in this position. Okay, you see, we can go now under the pectoralis major. We treated pectoralis major in the first day. Now I can make a fascial separation technique, technique 4, between pectoralis major and minor. Okay, so first I identify the pectoralis major, and then you relax the pectoralis major. I go to the ribs, and if I follow the ribs under the pectoralis major, I can feel here it makes plop, plop, and this is the minor. Okay, the lateral fiber of the minor. You can you can try to go with the shoulder in depression, exactly. Then you have an activation of the pectoralis minor, and you can feel this activity, and you release. Perfect. And again, then I feel the activity of the pectoralis minor. Okay. And if you want, you can release. Then you can go between the pectoralis minor and the pectoralis major. You say if it's enough. Huh? I go here, I feel the fibers, and I can go very deeply if the patient agrees. You release, please. Yes, perfect. And so this is a facial separation technique, technique 4 between major and minor. Okay. And if it hurts now, it's clear it's a problem in the minor. Then you can try to perform also a facial separation technique between the pectoralis minor and the ribs and the intercostal muscles. This is in this lateral part. I go now lateral from the pectoralis minor, and I try to go between the pectoralis minor and the ribs. Okay, it's a layer deeper. I can show it here. We have the pectoralis minor in this position. So first access was to go in this. Here is pectoralis major, and this is pectoralis minor. So first I make the separation technique here, and then I go here and I try to make a separation technique between the pectoralis minor and the ribs and the intercostal muscles. Huh? Okay. Here you can't reach very far, it's just limited, but sometimes this helps a lot to go in this area too. So you have two separation techniques between major and minor, and between the dorsal part of the minor, between thorax, ribs and the minor. Okay. And then we perform again. I can make a little retroversion and the technique 3.
이것도 지금 왼손으로 레트로버전을 만든 상태로 유지하고 하고 있습니다.
It's okay.
괜찮나요?
Okay. This is one position you can treat very well. And a second position, please, on your right side. Please put the hand like this. You keep it. Yeah, you can take your arm where you want. You go in this. Yeah. But you can use this arm as a pillow.
베개처럼 손을 깔고 이렇게 베개처럼.
Yeah, this is best position. So, you know, you stay like this. It's just for demonstration reasons, so you can see best what I perform. Otherwise, you can put the arm where you want, but so you can see it best. So in this position, it's very comfortable too, to reach the muscle behind the pectoralis major. And it's very comfortable. You treat here the serratus, the stabilizers of the scapula, and then you can, without changing the patient, you can go to the pectoralis minor, which is in the same group of muscles to stabilize the scapula. And with ladies with big breasts, the weight of the breast falls away from my fingers, so it's very comfortable to treat. And then you can reach under the pectoralis major. I feel here the fibers of the minor. And here too, you can say, please go to the ear with the shoulder, elevation,
Okay.
and then depression. And in the depression, you can feel the activity of the pectoralis minor.
네, 어깨 안정화 근으로서 세라투스 안테리오랑 펙토라리스 마이너가 같은 그룹에 속했기 때문에 이 자세를 하면은 세라투스 치료하고 바로 들어갈 수 있어서 좋고, 또 여성 환자 같은 경우에는 이제 유방의 무게 때문에 이 자세로 하면은 이제 비켜주니까 좀 더 그때도 효과적으로 쓸 수 있는 자세라고 하셨습니다.
Yes. So please practice this each for 5 or 6 minutes.